a black woman, visibly pregnant and about to deliver. She was rushed to a hospital in the United States, crying for, she was in severe pain, crying for to be admitted so that she can, be attended
Deliver.
to.
Mm.
And then the receptionist was just casually writing. You say, what do you say is wrong with you? Her slowly, like a slot. She was just sort of
Wow.
like a slow pull, you
Mm.
know. She was just, okay. When did you start experiencing pain? Even me watching that experience, I could not her, I could not imagine that somebody would have the hardness of heart to be treating a person she was writhing in pain on her wheelchair.
Today, we are getting into that act once again as we discuss health in Nigeria, but of course, from the global angle, the global north, global south, and it is today in global health. Do I call myself now? I think I need to look for a new name for myself. Do I call myself the convener or the sidekick? Because I can't pretend to take the lead on this, where we have Professor Uche Ugwaba. Good morning to you.
Good morning, Kyle. It's always a pleasure to be here.
Great, great to have you join us as well. And how are you doing today?
Doing good. It's a very good day. Very calm weather today. Not so cold, so I'm
Mm,
grateful. Mm.
yeah, I mean it's okay. It's not so cold. We are begging for Hamatan, not winter, just Hamatan, and we're not getting it. No fogs, nothing.
You guys are lucky though.
Well, no, we don't want this sun. We don't want this heat. We want Hamatan.
uh,
Yeah, no, but hey, this is where we are today, and it's another
mm,
edition of Today Global Health, and we're launching into this conversation. Of course, I'm sure you're aware of the sad events that have happened, the way in terms of patient management in Nigeria. When you hear of such, how does it make you feel?
well, it's really sad, learning about developments like this that puts Nigeria under global landscape in very bad repute. Um, it's unfortunate. We were just having this conversation off air that in the past recent weeks, Nigeria's health system has come under, I mean, we've always known that the system is bad. We've
Mm.
always known that, you know, healthcare in Nigeria is a question about, divine protection. You go to the hospital, but you go with your divine, mandates to pray for protection because anything can go wrong in that experience. But now, the global community is beginning to see the spectacle because our best our best exports have been disappointed in a very remarkable way by the health system. And so this it gives us a lot of worries. We've been writing about this, and I've been writing about this for over a decade about the need for reform in the health system. My doctoral dissertation was about reforming the healthcare system to achieve universal health coverage. And this was published over close to 10 years ago. And still nothing has changed. Instead, the things that I was looking at in my doctoral dissertation have grown worse. The system has, uh, uh, crumbled further. And so I think that, we need to talk about these things. We need to flag these issues. We need to begin to sort of problematize these things. And then like we and I have been saying, we need to begin to make active plans towards, convening the health summit where we can talk about, how do we move things forward in the health system of Nigeria. So that's where my mind is at when I hear all of these things.
Mm.
Really sadness and disappointment.
It is, it is. And what even makes it more complex or more compelling to start a conversation is the fact that, just last week, we were having a conversation around new hospitals, more professional hospitals springing up and providing quality service for Nigerians and all the opportunities that are being created, the ailments that they treat and all that. And if this had happened in the normal, and it's not to call out government hospitals, we know they could be overwhelmed at times and the quality that we get might not be the best because of the state of mind of the people providing the service themselves. If this had happened in a general hospital somewhere, I'm sure a lot of people have said, you too, why did you go there? But it
Mm,
is one of the hospitals that you expect so much from. And,
mm,
unfortunately, again, which is, I think, a lesson we must take out of this. A lot of us take in Nigeria, we take our children or uh, wards or anybody to the hospital without paying attention to the system, the process, the administration of healthcare.
mm,
We just take
mm.
them there and we relax. So we're not able
So,
to speak to specifics. But because I
mm,
think she paid attention, she was able to speak to specifics, talked about
mm,
how the child was carried, talked about how
mm,
it was dumped. I mean,
mm.
I'm sure in her mind she's comparing it with the attention you'll get outside. They're not getting it
Yeah,
here. So
yeah,
it speaks a lot to the health systems in
yeah.
Nigeria.
But Kaide, I was making this point last week when we were speaking about these things. You mentioned that new hospitals are springing up and all of that. And if you recall, I mentioned that new buildings it does not reflect quality of care.
Yes.
You
Yes,
know,
you did. You did.
and I also said that you actually had more expertise and competence in the general hospitals.
Yes.
I
Yes.
I said that a
Mm-hmm.
lot of these new hospitals do not have the highly competent staff. Like, in fact, most of the people who are running these hospitals, some of them are doctors who are in those general hospitals who come and set up a private, facility, and they don't have the same kind of quality of, high caliber, staff who work in the general hospitals, working in their private establishment. So we were having these same conversations last week, and I said, don't be fooled by the beautiful edifice.
Mm.
Those those a beautiful building can be a slaughterhouse, you
Yes.
know.
Unfortunately.
And it's unfortunate. It's unfortunate that this
Mm.
incident is happening because, I mean, I don't know what the Uche establishment looks like, where Dr. Chimamanda Adichie's
Yeah.
son passed on, but something tells me that it would look like a distinguished and prominent place where all the amenities are present,
Yeah.
and it will look like this is a place where people know what they're doing. So it means that the system, the issues go beyond just building a new hospital. It goes beyond just having the modern amenities. There is a fundamental systemic problem of the absence of patient care and safety in health service delivery in Nigeria. And this is one of the points we're flagging. You know, um, when something happens once, okay, you say maybe this is something that is unusual happening in the system. When it is happening a second time, you now say, okay, maybe there's a pattern here. But then when what has happened has been part of the lived history of many Nigerians in the health system, the only reason why we're hearing about these things is because somebody prominent has experienced this and they are speaking out about their experiences. But then this is the lived reality of the average Nigerian. The average Nigerian goes to the hospital. If it is not being ignoring them because they have not made their deposits or payments, it
Mm.
is it is gross negligence. Like, you hear of I don't know, I think it was last year, a couple of I know I can't even remember now. But then I don't know, I think we talked about this on this show. The story of a man. No, it wasn't on this show. It was when I was first interviewed by your station during the Lagos
Okay.
Health Week,
Okay. All right.
where I raised the story of a man who brought his pregnant wife, to the hospital, and she was not attended to because he didn't make a deposit of 500,000
Mm.
for maternity care. And she passed on. After she passed on, 500,000, in fact, the amount that was required to even get her out of that hospital was more than that amount. So the point is that we have a real problem about patient safety and care in Nigeria. We have so many other problems in the health system. There are myriad. If we spend the entire day today talking about the problems of the health system of Nigeria, we will not exhaust them. But I think that this issue of patient safety and care is one that strikes at the heart of the malice, the problem of the healthcare service delivery in Nigeria. There are countless horror stories you hear about the lack of standardization, you know, lack of processes put in place to ensure that when people go into, you know, a health establishment, they don't come out um, with more problems than they went in. And so you begin to ask, what exactly do we mean when we talk about patient safety? Okay, I think we need to look at the WHO framework because the WHO has done a lot of work on this area. You have the Global Patient Safety Action Plan 2021 to 2030, which the WHO, adopted, as far back as 2021. And, you had the 72nd World Health Assembly in 2019 adopting resolution WH 72.6 on global action on patient safety and mandate, and where there was a mandate for development of a global patient safety action plan. So, in other words, this is an area where there has been a lot of global attention. So, back to my question, what exactly do we mean by patient safety? If you look at the WHO, the way the WHO has defined it, the WHO says that patient safety is a framework of organized activities that creates cultures, processes, procedures, behaviors, technologies, and environments in healthcare that consistently and sustainably lower risks, reduce the occurrence of avoidable harms, make error less likely, and reduce its impact when it does occur. So if you listen to the story of, the experiences of, Adichie, Chimamanda Adichie and her family, you will see that a lot of these things were missing from, the plan, the treatment plan, of her son. Because yes, people can make errors, but what were the processes or protocols that were put in place to minimize the risk of those errors? you know, to minimize the risk that an anesthesiologist will be, would do things that do not fit into, what is, best practice in circumstances that presented themselves at the hospital. So, um, then the question becomes, at a national level, do we have, you know, these sort of standardizations embedded into the way health systems are supposed to? Like, if you say you're a health system running a health system in Nigeria, are there protocols that you have to follow and observe before you are even allowed to attend to any single patient that sort of promotes patient safety? How much are we uh, having conversations about patient safety with regulators? How much are regulators focusing on patient safety as a priority? How much do our citizens know about their rights to demand patient safety when they go to visit a care center? So these are the fundamental issues that strike at the heart of where we sit as a country. And I think that we need to be talking about these things because today it is Chimamanda's family.
Yeah.
Tomorrow, it could be ours. So
Mm.
this is something that you cannot avoid. You can't afford to sort of sit on the sidelines. It's a real concern when the people you trust with your healthcare are, are not observing, basic standards that promote safety of individuals that are receiving care, such that healthcare is not contributing to more harm than good. Then,
Mm.
you know, um, we are far from where we need to be as a country. We're not talking about, all of the other fundamental things about the health system that we know are required.
Mm.
We're talking about health workforce, the condition of health
Yeah.
workers the other time. And
Mhm.
so there are more serious issues. This one is the low-hanging fruit we can address.
It's just dealing with the immediate challenge that we've seen based on recent occurrence with
Yes,
certain ambassadors. And what makes this worse to an extent is the fact that these people, what they say about Nigeria matters because they
yes,
don't have a Nigerian audience, they have a global audience. So anything
audience.
they say typifies Nigeria. And that is it's sad that both incidents happened within a space of is that about
A
three
few
weeks
weeks.
to each other? Yes, and this is where
Yes,
we are. But again, I'm sure those who go for services abroad will also say that. I mean, abroad they make mistakes as well. There are issues where sometimes they get sloppy due to long hours of work or other events. So what really you have experience of the global north and south, and even in the south, the upper south and the lower south, if you're talking about Asia and Africa and all that. But what is the difference between all the events of sloppiness or errors in the healthcare systems in this global north and what we're experiencing in Nigeria right now?
The key difference is the fact that over here, there are protocols, there are systems, there are standards,
And when you say over
right?
here, you mean the West?
In the West, okay? There are standards of care, there are protocols that are put in place to ensure that the patient is at the center of health service delivery. Uh, Health service delivery in the West here, in the global north, has moved away from that model where the doctor knows everything. You know, in Nigeria, you still have this sort of paternalistic healthcare delivery system where the doctor is supposed to be the smartest person in the room. They are the ones who know everything there is to know about what should be done, and they don't engage and interact with patients in an effective manner to ensure that, you know, the treatment, the process of treatment is a joint and collaborative effort. So over here, we have moved away from that model. It's now a model that centers patients' rights. You know, patients' rights are at the center of the delivery of health services. And what that means is that is the system design tries to make sure that it eliminates one, anything that results in, error in the delivery of healthcare. Two, create opportunity for a feedback loop where, you know, people who are delivering care can can have their actions, overviewed or reviewed or scrutinized to ensure that something that was missed is caught. You go to your general practitioner. Your general practitioner refers you to someone who has expertise in the field. The person who has expertise in the field is working with a team that supervises, what the care that you're receiving. In other words, there is really very little room for people to experience errors in the delivery of health care that is not caught on. When there's standards and protocols that are put in place to catch on to things, it minimizes the risk of harm. I'm not saying that obviously you don't have incidents that occur, but then you don't hear things like, oh, they were supposed to receive this and they gave them the wrong medication, they were misdiagnosed. And then, meanwhile, in the health system of Nigeria, people are being treated for malaria when it is something else. You know, people will be prescribed something, medication, they start taking it, and then they go abroad, they're like, this thing would have killed you if you have kept on taking it. And so then the question is, who are these guys? Who are these guys who are, doing these tests? Sometimes it makes you question whether some of the people who parade themselves as doctors, whether or not they have been properly trained. And maybe we need to go back to even the training our doctors receive, because these days where people are always cutting corners, they cut corners through WAEC or through JAM, they cut corners in the university, malpractice and all of that. You now find that you have some individuals who are graduating from our medical schools who do not have any business being near a hospital.
Mm.
And I'm saying this because I'm not trying to denigrate the profession. I know that even within the legal profession, there are some people who are graduating as lawyers. I have no hope for that. And I have no hope for the kind of legal practice they will put up or they'll be involved with, because they don't either meet the character conduct or the character requirement to be lawyers, or they bought their way through the
The system.
university.
All right.
And
So if you're looking at this now, what you are saying I mean, the reality is that in Nigeria, okay, in the West, there are errors. In our parts of the world, it's more of ineptitude, lack of procedural structure
standards,
or standards. Those are so ours is bigger. Ours is institutionalized. It's not
yes,
an individual making an error.
yes. Yes,
Wow.
individuals making an error is a fact. It's a fact of any human system. You would
Yeah.
always have that one individual that makes that error.
Mm.
Some of these errors are induced by racism. I'm not going to come here and start telling you that Western medical care doesn't have a problem. There's a huge problem about racism
Mm.
in the health system. You have situations where, and it's a fact. I'm currently working on an article, or on undertaking a research where I'm tracking the experiences of Black and racialized women in the health system of Canada, where and even sort of our indigenous folks, where research is showing there is ample research evidence that shows that, Black individuals who go to receive care are, are less likely to come out of that experience unscathed compared to their white colleagues.
Oh, really?
That's a fact, yeah. It's a fact that when a Black, you only need to sort of check social media to see videos. There's a particular video I saw sometime last year that, it struck me. It made me so sad and sorrowful. A Black woman, visibly pregnant and about to deliver. She was rushed to a hospital in the United States, crying for, she was in severe pain, crying for to be admitted so that she can, be
Deliver.
attended to.
Mm.
And then the receptionist was just casually, right? You say, what do you say is wrong with you? Her slowly, like a slot. She was just sort of
Wow.
like a slow pull, you
Mm.
know? She was just, okay, when did you start experiencing pain? Even me watching that experience, I could not her, I could not imagine that somebody would have the hardness of heart to be treating a person she was writhing in pain on her wheelchair. Okay.
Yet.
And guess what? They said, okay, they turned her away. They didn't admit her.
Oh,
This woman
really?
she gave birth outside.
Mm.
So it now became
National,
a
global. Yeah.
scandal.
Mm.
And then, this happened in the US last year. Okay, so of course, obviously, yeah, somebody's going to say, "Well, Professor Dr. Ngwaba, isn't that also patient safety?" Yes, obviously, patient safety has been ignored there. But then this is deliberate human. I won't. Well, if I want to
It's
be
not a
charitable,
systemic.
I'll say I will call it an error. But this is systemic is is a different. I don't know whether we should not call it systemic. If
Okay, well,
it is a
because there's a pattern already.
there's a
Yeah.
pattern.
But it's a different kind of, it's not a
It's a different kind of
technology gap,
systemic.
yeah, or
Uh-huh,
competence gap. Yeah.
it's a different kind of systemic
Mm.
because these are induced by, you
Yeah.
know, a deep seated. We know where the issue lies. We
Mm.
know
Mm.
the demons we're fighting in that
Yeah.
regard.
Yeah. This is
But
more of
then,
emotional or,
yes,
just,
yeah,
yeah. Okay.
yeah. But then, our situation here is just in Nigeria. Our problem is it's a much different kind, and I think it's
Mm.
more invidious because in the Nigerian system, you do not go into like over here, you're a Black person, you're going to receive care. You already know that it is hit or miss. That's
Mm.
why many Black people, when they go to hospitals, they like to deal with a Black doctor, a Black nurse,
Okay.
because they will understand their issues better.
Mm.
They will understand when we say, Kai, it be like say malaria, they catch me, they will
Mm.
understand, what that
What it
means
means.
and
Yeah.
what kind of care protocol, to, prescribe for you. And then they would also less likely be exposed to racism. Okay. For a Black woman, her pain will more likely be recognized because there's this part of this racial trope is that Black people don't feel pain. And it comes from,
Mm.
slavery, where, they just feel like you're less human. White pain is treated with,
More concern and care.
urgency and
Mm.
concern. But Black pain is normalized. Like, okay, it's normal.
You're
You know,
tough. You're
you're
built for
tough.
pain.
You're built to withstand pain. So
Mm.
they and this comes from even some of the you know racist research that has been undertaken in the past. That kind of that in the past black people used to be experimented on
Mm.
for
Mm.
for advancements in medicine. The man who founded gynecology or who advanced the field of gynecology experimented on Black women without anesthesia being administered.
Wow.
So there's an entirely morbid history about the experiences of Black people in the healthcare system
Mm. Mm.
in the
And
West.
looking at our case here, we'll take a short break now, but just before we
Mm,
go on a break, I wanted to ponder on this. These same doctors that, I mean, we say they are involved in this, we call systemic failure of
mm,
providing quality healthcare to the average Nigerian. They travel abroad and
mm,
we don't see them exhibit these same errors? I mean, what? So is it more of the people? Is it technical? Is it technology? Is it the environment? Is it the talk that the air we breathe in Nigeria aids you to fail? What really is it? But well, I'd like you to address that just after this break. Don't change your dial.
Your question is it's a very important question because you're asking, if I summarize the question, you say, what is at the roots of the decay and rot we are observing in the health
Yes.
system
Yes.
about patient safety and all that? Look, there are so many factors. One, some of the usual suspects, the fragmentation of the health system, the lack of, proper regulatory oversights. But I think one place I would like to sort of start is to point to one, the fact that, the system, these problems we're talking about are systemic. In other words, when we say they are systemic, we're saying that entire systems and processes that need to be baked into healthcare delivery have faltered in catching these occurrences. Patient safety is supposed to be a default. There should be a default response towards safety. Let me think about, say, for example, if you're going on a construction site, right? There are a number of safety standards that you must observe. For example, you cannot come on the construction site wearing your normal regalia or something.
Yeah.
You must wear helmets. In fact, there are in some sites you have to wear special boots. You cannot just go there with your shoes and all of that.
Yeah, even
This
reflective jackets.
exactly reflective jackets. So these are safety standards that are baked into the processes for how individuals who are non-personnel come on the construction site. And even for personnel working on the site, there are safety equipment that they need to sort of put on. So in other words, every profession, that interacts with individuals that can result in harm puts in place protocols and standards that will ensure safety. I'm not saying that the health system in Nigeria does not have the safety standards. Of course, on the books, you will have manuals that say these are the standards
The
that
do's and don'ts.
should be observed, the do's and don'ts. But whether or not that translates into, practice is one question. What happens if the practice is not observed? What consequences flow from that? It's another question. This is a country where harm occurs and people say, oh, let's leave it to God. It's your fate. It's their time. We are a very religious society.
Man was born to die.
We over, spiritualize things and experiences that should not be spiritualized, experiences that people should be held accountable for. Very soon now you hear some people saying they are suing the hospital, say, they should just leave them now. It wasn't tough. God gives, God takes. Meanwhile, these are individuals who have failed to do their responsibility, to live up to their responsibilities. Okay. And then when you couple with the fact that as a society, and unfortunately, this is something that pains me, but as a society, the value of human life is very low. The Nigerian life is not worth much. It's not worth much at all. You only need to see, for example, when the unfortunate accidents where Anthony Joshua was involved in occurred, what was the reaction? Even the bystanders. People were crowding the place, taking selfies. In other civilized places, the first thing is people who are trained in first aid. In Australia, where I was, there are certain professions you involve in. You're mandatorily trained in first aid. People are, yes, and when you're trained as a first aid worker, if you're close to an accident scene and you don't step into air to assist, you're going to be in trouble to render some sort of first aid care.
Okay.
So normally the first thing is a patient safety mindset should have kicked in for people within the vicinity to say, okay, somebody call an ambulance. puts the victims in a
How do you
position
even
where
position exactly? How do you even position a victim? Do we know all that?
that's the point. We do not know that. People are manhandling, filming the whole
Yeah.
thing, taking selfies. I'll say, it's Anthony Joshua. It's the opportunity to bask in the misery. At that point in time, he is disoriented. He's trying to, he does not understand what is happening around him. People need to switch from, switch into a mode of, care.
Hmm.
But then what you saw was just a spectacle, so embarrassing. It was like being an Algerian and watching your national team misbehave after the match.
That hit home. Nigerians will not be happy with you this morning. Wow.
Oh, you understand? If I
That's
was an
how bad it
Algerian,
was. Mm.
like I don't know how I would feel. I would feel so
Mm.
embarrassed. Like the loss is one thing, but the misbehavior afterwards.
It's
Come
another.
on,
Mm.
don't be a sole loser.
And,
So
and that leads us to the next question. Do we even know what we are entitled to? And I'll give an example. When one of my kids, when I gave birth, my mom was around and they needed to do CS at some point as a matter of emergency. And they said, okay, we're going for it. And I said, okay, no problem. I signed, gave the authorization. I just sat there. And my mom was looking at me, it's like, you're not panicking. I said, no. It's like, because the expectation when you say you're going for CS in
mm,
Nigeria, everybody is, a lot of times people are panicking, and she
mm,
started telling me stories of things that have happened during CS. And the truth
mm,
is, that was a public hospital in Ghana.
mm,
And, in and out, and, all through the process, we're talking about how nice the hospital looks, how
mm, mm.
cordial, how this. So I'm wondering, do we even know what our rights are as Nigerians and what really are these rights?
Okay, let me ask you a question to put this in context. When you go to a hospital in Nigeria, um, for a procedure or something, does anybody spend the time to sort of explain to you what to expect, um, how things will happen, if there's a problem, how they will try to resolve it, things that can potentially go wrong? Does anybody spend time to explain that to you before
Well, you
you
don't
go
even
into?
you might not even have the right to talk because, like, are you going to operate yourself? Why do you want to know the entire process? That might happen. So,
That's the answer. That's the answer to your question. But meanwhile, over here, that's the experience you get. If you go to a dentist, you go to the doctor, and they say, okay, go for this test. And after the test, you come back, you sit down in the consultation, the doctor explains, okay, so this are course of treatment we propose. This is one option you can do. This is another option. We also recommend you probably get second opinion if it's something that, oh, you need to probably see a specialist because there are some things here that require, a specific consultant or specific specialist to see you. Like you're part of the treatment plan. You are informed of what is happening with you. You're informed of the options that are available to you. You're informed of course of treatments that are available, and you know, and all that and all that. But then my mom was a nurse, so I know how the health system. I know,
pause.
that when I speak about the health system, I'm not speaking like somebody who doesn't know the inner
Hypothetically.
working.
Mm,
I grew up going to play around the hospital environments where my mom is working, and
mm,
I see some of and my recollection does not show me that. And of course, having, grown up, living my adult life in the hospital setting, and seeing, and seeing also the experiences of people,
you're able to compare.
I'm able to compare, and nothing tells me that,
Mm,
that this model of care that centers the patient. I started out today saying that patient safety centers the patient's experience in
mm.
the delivery of healthcare. That is not the case in Nigeria. In Nigeria today, the doctor knows it all. The nurse knows it all. In fact, there is no patience for you. If you go to hospital, some nurses have, they put up attitudes that makes you regret even coming to the hospital.
Mm.
They make you look like you've done something wrong. It's your fault that you're sick or something, you know? And, they treat you in a way that makes the experience entirely unpleasant.
Mm. You
So,
know, let me share this experience. I remember then when I was about to get married. So I'd come home to Nigeria and the church needed, was it the church? Someone needed the what do you call this? The genotype, your
Yeah,
age,
yeah, yeah.
you
That
know,
that would be the church. Yeah.
that'll be so. So we said, okay, we're told when we're in Ghana, I said, okay, we'll get to Nigeria and just do it. First experience. So I said, okay, let's go to Ikeja. I'm very sure that place is like a highbrow area. We'll get a
Mm-hmm.
good place to do it. So we got down at Ikeja and we were around the bridge, the Ikeja bridge. So we walked to
Mm,
one lab there and the
mm,
place was crowded.
mm,
The reception was dark. There was no light.
mm,
There was a lot of heat. The first thing
mm.
that hit me was a lab. So how then do you preserve all the samples you
Samples.
collect? But I said, okay, I did it. I asked, I inquired, we thought, oh, sit down. Someone will be with you shortly. And after a while, this guy comes in with some things in his hand. And we stood up. I said, so we told, he said, oh, yeah, I've come to meet you. So we all stood up that let's go to the room where you will take our blood and all that. And he looks at us, myself, my wife, who was shocked. He's like, no, sit down. We'll do it here. I was,
What?
yeah, at the reception. I was so shocked. I said, what?
What?
I had to change the story because I knew we could easily get angry. Why are you wasting my time? I said, oh, we just want to inquire. So how much is it? Blah, blah, blah. And I left,
Good of you.
and I left. We went to another place in Ikeja. It was the same story. So,
Wow.
yeah. And that's why I'm asking, do we even know that it is wrong? Because all the samples I've taken in Accra, there is, and once you enter the place, there is AC, it's chilling. You go to,
There's
there's
a
a
special
special place.
consultation room
Exactly.
you go into.
Exactly. You go into the room and you have this reclining bed kind of thing where you
Yes.
put your arm in a particular way and
Yes.
you begin to, and that's what I was expecting. But two places in Ikeja, I can never forget this experience because I'm still shocked. My wife could, like we say, bush babe. She was just looking at me
Mm,
like,
mm,
what's going on?
mm.
That is the kind of service. I don't know. I'm sure a lot of people might be wondering, well, what's the big deal? Is it not your blood they want to take? But I'm
But these are the issues, isn't it? It starts from things like this, isn't it?
exactly. I raise this because we've been talking about the hospital, but this is a healthcare in quotes. Okay, let me just say need. Let me not use the D word I wanted to use. A
Mm.
healthcare challenge. So how do we come out of this? How do we begin to reduce this lack of safety within the healthcare system in Nigeria?
Let's start from the regulatory space. Who are the regulators? What are they doing to ensure that those that are involved in the delivery of healthcare, whether the public hospitals or the private hospitals, that they are conforming to best standards and practices? What are even those best standards and practices? Who knows about them? Is it just something you put in your policy book somewhere and nobody knows about those things? How informed are patients of those standards and practices, of their rights when they go to receive care? We have what's this Savicom? I don't know whether those things are still active.
Yeah,
Uh-huh. There's
still
supposed to be
exists.
a complaint mechanism. Do we have the equivalents for patients who are receiving healthcare, not just Savicom, but a kind of an equivalent like an ombudsperson or an ombudsman,
Yeah.
where individuals who are exposed to practices in the health system that are harmful can go and report their experiences, and those practices can be investigated, short of going to sue the hospital or suing the doctor. We know that to take legal action is not exactly cheap. Many people will be disincentivized to take legal action. I'm a lawyer myself. I know how expensive it is.
Yeah.
So do we have systems, complaint mechanisms in place to ensure that instances of poor service delivery can be reported, and where the doctors or the health institutions that are involved can be investigated, and if found wanting, their licenses can be suspended or withdrawn? All right. So even within the private practitioners, are there, do we hear about health conferences taking place in Nigeria where these issues are being discussed or tabled on the agenda for discussion? Do we see national summits, or do we see national conferences or workshops or symposiums on these issues being organized? Is this something that features at all in the conversation in the public domain or in the sector? Is anyone talking about these things? So I'm asking these questions, rhetorical questions, just to give you an idea of where we are as a nation and essentially the complacency around, patient care. All right. I wrote long ago in my doctoral dissertation that healthcare is not a right in Nigeria, regardless of whatever the African Charter on Human and People's Rights, which Nigeria has domesticated, says. Healthcare is not a right. Why do I say that? Because there is an attitude, okay, in the country that comes from health service providers, health service recipients, that reflects the fact that they do not believe that healthcare is a right.
It's a favor, kind of.
Yes. And even when politicians do anything in the health space, it becomes a talking point, a bragging point. My administration has built so number of health facilities, or we bought so number of drugs. My friend, shut up your mouth. That's your job. That's your constitutional responsibility.
That's it.
You are doing the basic responsibility of government. It's not something to talk. It's not an achievement.
Yeah.
Do you understand?
Yeah.
So it is a fact that in the Nigerian political space, in the Nigerian social space, in the Nigerian religious space, or whatever space at all, healthcare is a divine blessing. It's not a right at all. It's not a right to demand.
Yeah, yeah.
The conditions for people to be healthy is not for the citizens to demand. Because if Nigerians cannot afford to eat decent meals, it affects their right to health.
Yes.
No one is talking about my right to have access to adequate nutrition. Because nobody believes that it's their right. Nobody sees, and even within the Constitution where these obligations are provided for, it is contained in Chapter 2 of the Constitution, which the Constitution itself says is not justiciable.
Yeah.
Meaning that it's a right you cannot enforce. So in other words, it's not a right. Only an aspiration. So this is where we are as a country. We are a country that do not value human lives. We're a country where you can be traveling. I remember those days when we were traveling by road, my parents to the east, and you can just randomly see like a corpse on the road, and the vulture is eating it, and nobody.
It's been there
it's been there for days. This is the country we live in. Human life has no value. And so when you live in a place where human life has no value, it then means that people are unable to summon the sympathies or the professional will to do things properly. Nigeria is a place of anyhow. We do things anyhow. And that's why when our cultural experts come, and then you just pray, God, don't let them go into any crisis. Don't let them have any this thing. Because the moment they do and they go to, our health systems, things like this will happen. Yeah. Things can happen anyhow.
And it feels like our lifestyle makes it easy for, in quote, the devil to operate.
Yes.
Because, with this now, you would say, okay, it sounds better when you say it in local language. That means the devil used him. That child died.
Yes.
It is people in the village, but they just have to go through him. But then wonder, how come the people in the village don't use the doctors abroad?
Exactly.
And you asked a couple of questions there as we begin to bring this home. You asked a couple of questions about conferences, policies, and the truth is, a lot of conferences happen, a lot of high-level meetings happen. Or is it just the case that they are too esoteric in nature? We don't bring it down to the level of everybody. So the few who know about it will kill themselves at that top to make sure that all these hospitals provide it for them. But the average general hospital, I don't know if it's a medicine. I think there's a law that says, is it certain rights or so, or numbers or so should be posted at the entrance of hospitals.
mm,
for patients. There's a law like that, but I'll do more findings on that. I actually found out about it last year during the health
mm,
month, that there's a law.
mm,
I think the numbers of certain people you can report to, but
mm,
do we see all this? How many Nigerians even know? How many Nigerians know that when a doctor is going wrong, you can actually ask that doctor to explain things to you and not just
mm.
shove you off?
Your right information.
Yes.
So that is what that means. But then the other question the point again you raise about how many people you can report to. The question is, when people make those reports, what happens?
Hmm.
What is the follow-up action? Because this is a country where people don't take accountability for their actions. People do things and they say, from our political class down to the citizenry, there's no measure of accountability. People do not take accountability. The average Nigerian does not know how to be responsible and accountable for his actions. He always has an excuse why his bad behavior should be
No, no,
tolerated.
not an excuse, a reason.
Oh, a reason.
A
Because
reason.
an excuse will mean you know
The,
you did wrong.
uh,
A
the
reason means
reason.
you stand on your
You
behavior.
stand by it. So you do it again tomorrow.
This. So
And,
I think that we need to begin to work from, because you see, the changes we are looking for has to come from it has to start with us.
mm,
Okay.
mm,
There's so much power in the citizenry that has been left dormant. Citizens have to begin to be informed so that they can make demands of
mm,
the systems that serve them. If you pay so much money to go and receive care, at the very minimum, you should not leave that experience with more harm than good.
mm, mm.
So these are basic
So,
fundamental rights. We can start from that.
to break this down and make it, should I say, ingestible for the average Nigerian. So what you're saying is, if I go to a hospital
Yes.
on Monday, I'm
Yes.
diagnosed with malaria. On Tuesday, the treatment has been going on for about a week. I don't see any changes. I go back to the same hospital, or let's say another hospital, and I'm
Mm,
diagnosed with typhoid or any other ailment.
mm.
What you're saying is that, can I sue the first hospital for negligence or for improper diagnosis? Do I have a
It's
right to take up that hospital?
You should be able to. I wouldn't say sue because, again, I want to discourage litigation as the first resort.
Okay.
I would like to say there has to be mechanisms in place that you can sort of engage at an administrative level
In that hospital,
for
first of all.
embedded in that hospital for a
Okay.
review. What went wrong? Why was I? Can you explain to me what exactly you did that Scott did not catch this error or this mistake? You should be able to engage those mechanisms at a level of administrative review.
Mm,
And where the decision from those administrative mechanisms are not satisfactory, you should be able to then appeal those distance for a higher body to review it. And if a higher body is not available, for the court to review it through a process of judicial review.
okay. All right. So
Because so what I'm saying is that there has to be one of the things we need to invest in terms of reforming the system is we have to put in place mechanisms for patient education,
mm,
all right, or citizen education about health and their rights in the health system and about their obligations to or the obligations of health service to providers to deliver competent care or safe care in safe environments.
all
And
right.
then if those mechanisms fail, there should be mechanisms for complaints that
Okay.
can be engaged.
Okay. And I dare say that maybe it's time to just make this appeal that today Global Health is not just a radio program. It will be breaking out into other aspects of advocacy and sensitization, and one of which is what we're talking about right now. So if there is any association out there, any government institution out there, any development partner out there that isn't ready to partner in patient sensitization, we are available to have this conversation, because it's
Mm,
important that we begin to engage Nigerians. If you're able to ask a doctor for more explanation, it will go a long way
mm,
to save a lot of
yes.
people. I remember I went to repair, and this is not just with doctors. I went to repair something, and after the guy, I expected him, okay, so I should come back. After like 2 days, I went back, wasn't ready. The third day I go, and it's done. And I was asking him every time I went, what is the problem? He says he has not opened it. I went there and it's done. And I asked him, what is the problem? And the next question he asked me is, if I tell you, you feel repair them.
you know.
And that is the kind of explanation
That's the
reaction
attitude.
exactly we get
That's
from
the attitude.
those providing service in Nigeria. But this
That
is your
you're not
health.
entitled to get the information.
Exactly. But this is your health. You have a right
Mm.
to know what is wrong with you. And that is one thing we should get into. Prof, want to thank you so much for your time with us today, for always being there to educate the Nigerians. And we say, do enjoy the rest of your day.
Thank you.
All right, then. So we'll wrap up the show right here, right now. Now we say thank you to everybody who's tuned in.